Usually, the debate over solving the nation's healthcare needs focuses on insurance companies or prescription drugs. But KXAN Morning News anchor John Dabkovich shows us how the UT Dell Medical School is taking a different approach that has the potential to save trillions.
What if our approach to the healthcare crisis has been all wrong, or at the very least, what if we've been overlooking a huge part of the problem?
Show the next picture.
The latest estimates show Americans spent more than $3.5 trillion on medical care last year, much of it on tests, prescriptions, and procedures that weren't even needed.
They've studied this lots of different ways, and from the best we can tell, we think that about a third of what we do in healthcare, money that we spend on healthcare, is waste, which essentially means that it's not making people healthier.
The UT Dell Medical School is one of a number of universities now trying to eliminate all that extra spending by teaching something called value-based healthcare, teaching med students about more than just the science of medicine.
But one thing that we have traditionally not taught in medical school is anything about cost. And the problem with that is that our patients care about the cost. You know, if we don't teach costs, right, and you get a menu with no prices, you order the filet mignon every single time.
Teaching value-based healthcare is one thing. Practicing it is another. Historically, doctors have been paid a fee for providing a service, regardless of what happens to the patient. Value-based medicine rewards doctors based on the outcome for the patient.
If you're going to get a knee replacement, the outcome that probably matters is, can you climb your stairs? Yeah. And so we need to determine what those are for different conditions, be able to measure them consistently, and then be able to compensate health professionals for reaching those goals.
Morieta says the goal is to have half of all medical billing nationwide done this way in the next few years. A lot of medical schools don't even have anybody on their staff who can teach the business side of medicine, so UT is actually doing it for them by partnering with an Austin-based company to provide online courses in value-based healthcare for med students across the country. John Dabkovich, KXAN News.